The first point will be plan. Plan the test, including a plan for collecting data. My questions and predictions will be: how much time and effort from the nurse will it take to ask patients about their insulin dose taken at home? Could it be 2 to 3 minutes per patient? Will questioning the patient prevent overdose medication implementation? On the who, what, where, and when, we'll conduct the questions on Wednesday to hospitalized diabetes patients during blood sugar check before preparing the regular insulin dose. And the plan for collecting data will be that each patient will answer a brief survey about their hospital experience on discharge. Second, do. Run the test on a small scale. Describe what happened, what data did you collect, what observations did you make. We're going to use 5 patients who were able to provide feedback about their insulin dose they receive at home on a regular basis to the nurse in charge of the test. 2 of the patients were not able to provide the correct dose of insulin they receive at home due to family member in charge of administering the dose of medication. And the nurse in charge of the test was confident that the small test was able to provide good results on insulin dose feedback from patients. Third, we do the study. Analyze the results and compare them to your predictions. Prediction 1. It will take a few more minutes of the nurse time before insulin administration, but will produce better communication with the patient regarding the regular insulin dose at home. Prediction number 2. The extra effort from the nurse will be worthwhile because will increase patient safety and prevent him from giving an incorrect insulin dose. Prediction number 3. If a patient is not able to provide feedback to the nurse regarding their insulin dose implemented at home, the nurse will be extra careful and consult with the doctor if the dose seems out of range for the patient. Number 4. Act. Based on what you learn from the test, make a plan for your next step. In this case, we determine what modifications we should do if we adapt, adopt, or abandon. The nurse in charge of the small test will receive the results from the nurses involved in conducting the test and analyze the data to implement a plan for the unit. The nurse in charge would like to put a team to work together to come up with a plan to implement the changes on the whole unit in the coming days. Thank you.